Psalm 104 verse 14, the Bible says, God gave herbs for the service of man. Every herb has a different effect on different parts of the body. And God, in His wisdom and mercy, has given us some herbs that directly affect the liver to the point of cleansing it and toning it.
Believe it or not, nearly 70% of the world's population relies on herbal remedies for their primary health care. According to Dr. Barbara O'Neill, herbs are nature's most powerful healing agents that the pharmaceutical industry doesn't want you to know about. Dr. O'Neill shares groundbreaking insights into herbal cures that can reverse chronic illnesses and boost your immune system. Don't miss this chance to explore these incredible remedies that have been hidden from you. Your health may depend on it. Dr. Barbara O'Neill discusses the significant role herbal remedies have played throughout history, tracing their origins back to ancient civilizations such as the Egyptians, Chinese, and Greeks. These cultures utilized plants like willow bark for pain relief, a precursor to modern aspirin, and garlic for its antimicrobial properties. Even major historical texts, including the Ebers Papyrus and Dioscorides De Materia Medica, document over 600 herbal substances used for various ailments, which establish a foundation for herbalism that we see today. Research shows that herbal remedies are effective and have therapeutic benefits. For example, St. John's wort has been shown to help mild to moderate depression, while echinacea is recognized for its immune-boosting capabilities. Studies have also demonstrated the anti-inflammatory effects of turmeric, particularly curcumin, which is being explored for its potential in chronic disease management. The synergy of multiple phytochemicals in herbs often enhances their efficacy, a concept known as the entourage effect, which is gaining traction in scientific discussions. Herbal remedies remain relevant in contemporary healthcare due to a growing trend toward natural and holistic approaches. As individuals seek alternatives to pharmaceutical interventions, herbs provide accessible options with fewer side effects when used appropriately. Many integrative medicine practitioners now support using herbal therapies alongside standard treatments, seeing their potential to enhance patient outcomes. For that reason, herbal cures have gained popularity as natural alternatives to conventional medicine, often offering holistic benefits for health. Many herbs contain active compounds with anti-inflammatory, antioxidant, and antimicrobial properties that may support the body's healing processes. However, their efficacy can vary based on factors like preparation, dosage, and individual health conditions. Let's check out 5 best herbs according to Dr. O'Neill. The first one is cayenne pepper.
Cayenne pepper does not cause any bleeds. In fact, if cayenne pepper is going through your arteries and your veins and it finds any bleeding, it'll seal the bleeding blood vessel. How come it can thin the blood and yet seal bleeding blood vessels? Well, God said that He gave herbs for the service of man. So the cayenne pepper comes in and says, where would you like me? I'll thin this blood. Oops, I'll seal off that bleeding blood vessel. It's a powerful herb. The book Back to Eden by Jethro Kloss, he devotes half a page to every herb and he devotes 10 pages to cayenne pepper. It's a powerful herb.
It's rich in capsaicin, which enhances blood circulation by dilating blood vessels. It also lowers blood pressure and improves overall cardiovascular health. Regular consumption may help prevent heart disease by reducing cholesterol levels and promoting healthy arterial function. The anti-inflammatory properties of cayenne also contribute to pain relief, particularly for conditions like arthritis, neuropathy, and muscle soreness. To effectively use cayenne pepper, it can be incorporated into meals, taken as a supplement, or applied topically in ointments or creams for localized pain relief. Recommended dosages vary. For general health, start with 1/8 to 1/2 teaspoon daily in food, while for pain management, topical applications containing 0.025% to 0.075% capsaicin may be applied 2-4 times daily. For those sensitive to spice, gradually increase the amount to avoid gastrointestinal discomfort. Next on the list is charcoal, particularly activated charcoal. This is renowned for its detoxification properties, which effectively absorb toxins, chemicals, and poisons in the gastrointestinal tract. As a result, it helps prevent their absorption into the bloodstream.
Charcoal is a remarkable substance because charcoal can absorb up to, I think it's the figures are about 150 times its own weight in poison. Now, charcoal is unique in that it not only absorbs poison, it neutralizes poison. That's a very important point. So you can use it internally for any poisoning, or you can use it internally for diarrhea. And a lot of people will travel with charcoal now when they go to Asia. You can actually get charcoal tablets. You can use charcoal externally for bee stings, wasp bites, spider bites, snake bites. But when you mix charcoal with water, it's like mixing dirt with water. So I'm going to mix it because I'm all for no mess, and charcoal's very messy.
It is particularly useful in treating acute poisonings and overdoses, as it can bind to substances such as pharmaceuticals, heavy metals, and certain chemicals, facilitating their elimination from the body. To prepare a charcoal poultice, mix activated charcoal powder with a small amount of water to create a paste. The consistency should be thick enough to hold its shape yet spreadable. Then, apply the poultice to the affected area and cover it with a clean cloth or plastic wrap to enhance absorption. You can leave it on for 1 to 2 hours, ensuring it remains moist to optimize its efficacy. Dosage generally varies based on the severity of the condition. For general detoxification, 1 to 3 tablespoons of activated charcoal may be taken orally with water, but for poisonings, a healthcare professional should guide the dosage. However, never overdo the charcoal application because charcoal can also absorb beneficial nutrients and medications, reducing their effectiveness. After that, we will talk about castor oil.
Castor oil is so thick, and that's why a lot of people hesitate to put it on their skin because it's so thick and gooey. So if you had an area, let's say bone spur, castor oil will break up a bone spur, isn't that good news? So you had a bone spur on your wrist and you rubbed castor oil in, well, it's so sticky. Now, if you've got time, and I don't know many people who have this much time, if you have time that for 10 minutes you just massage it, it will go in. So it'll eventually go in. But all that will go in is what you massaged in. But if you put a compress on it, you can get about 10 times more castor oil in than if you just massaged it on. And if you're busy like I am and haven't got time to massage for 10 minutes, you just put it on, put that on, and we bandage that overnight. And remember, when you bandage up between the hands so that it doesn't fall down. That thumb will anchor it there, and that can be overnight. In the morning, what Jamie does is she takes it off, folds it over, because she's going to use this again and again and again. That's why we call this a compress.
Derived from the seeds of the Ricinus communis plant, it is recognized for its therapeutic properties, particularly in breaking up cysts, enhancing digestion, and promoting skin health. To address cysts, castor oil's ricinoleic acid penetrates tissues, reducing inflammation and facilitating the breakdown of fibrous tissues. For digestive health, it acts as a laxative, stimulating bowel movements and alleviating constipation when ingested. In terms of skin health, castor oil hydrates, soothes irritation, and may reduce acne due to its antimicrobial properties. To prepare a castor oil compress, start by saturating a clean cloth or flannel with warmed castor oil. Fold the cloth and place it over the targeted area, ensuring full coverage. Cover the cloth with plastic wrap to prevent leakage and add a heat source such as a hot water bottle or heating pad to enhance absorption. For effective use, apply the compress for 30 to 60 minutes, ideally daily until desired results are achieved. Now, let's move on to the next, onion. Dr. Barbara O'Neill emphasizes the therapeutic potential of onions due to their anti-inflammatory and infection-fighting properties. Onion contains quercetin, which is a potent antioxidant. For ear infections, she suggests slicing raw onions and placing them in a cloth to create a poultice, which can be applied to the outer ear for approximately 20 minutes to help reduce pain and inflammation. Additionally, the antimicrobial properties of onions make them effective for soothing sore throats. A simple remedy involves finely chopping raw onions and mixing them with honey, allowing the mixture to sit for a few hours to extract juices. This remedy can be taken by the teaspoon to help cure throat irritation and fight infection. If you consume onions in salads, soups, or as a seasoning on a regular basis, It can also boost your immune system, providing ongoing benefits against various infections.
When you cut an onion, what happens? You start crying, is that right? And that's a good illustration of what the onion does. It's very good at clearing all the eustachian tubes. So it's a good time to cut up an onion is when you've got a cold. And what you can do with a baby, you can't do a lot with a baby, obviously, but you can, if they have a cold, you can cut up an onion or slice up an onion and you can put it on a plate in their bedroom and they will breathe in the onion fumes and it will help to clear the airways.
Finally, we will discuss potatoes. They also have anti-inflammatory and analgesic properties, which make them effective for reducing inflammation and providing pain relief. To prepare a potato poultice, simply start by washing and peeling raw potatoes, then slice them thinly or grate them to maximize surface area. Apply the potato slices or grated potato directly to the affected area, ensuring skin contact. For enhanced effectiveness, you can wrap the potato in a clean cloth to maintain moisture and warmth. Leave the poultice on for 30 to 60 minutes, allowing the potato's natural starches and enzymes to penetrate the skin. Repeat the application daily as needed for persistent pain or inflammation. Additionally, for systemic benefits, consuming cooked potatoes can help reduce inflammation internally due to their high content of vitamin C and B6, potassium, and antioxidants.
Potato is used for tissue inflammation, swollen eyes, sore eyes, red eyes. It can be used for ingrown toenails, so tissue inflammation. Sprained ankle, very good on sprained ankle. So the lady that had the swollen knee, I said to her, put a potato on. Potato is very cooling, so it's great for all tissue inflammation. The potato is also a drawer. I've also seen this draw out splinters. You know, sometimes you get a splinter in a finger that's just too painful to get out. If you put the grated potato on, it'll keep that swelling down. It will not get pussy or what they call infected. And usually after a couple of days, you can just get a needle on the tip of it, press it, and it'll usually just come out. I've just seen that happen a few times.
Numerous studies have investigated the medicinal properties of various herbs like these. For example, research published in the Journal of Ethnopharmacology demonstrates that Echinacea species can significantly reduce the duration and severity of colds due to their immune-modulating effects. A meta-analysis in phytotherapy research found that ginseng enhances physical performance and cognitive function by modulating neuroendocrine responses and reducing oxidative stress. Mechanisms of action at a biochemical level reveal how these herbs exert their effects. Curcumin, the active component in turmeric, exhibits anti-inflammatory properties by inhibiting nuclear factor kappa B, NF-κB, signaling pathways, which are crucial in regulating immune responses. Studies indicate that curcumin decreases the production of pro-inflammatory cytokines, such as IL-6 and TNF-A, leading to reduced inflammation. Garlic, which is a common item in every kitchen, can offer cardiovascular benefits through its active compound allicin. How? Allicin enhances nitric oxide production, promoting vasodilation and improving blood flow. Research published in the Journal of Nutrition shows that garlic supplementation can lower blood pressure and lipid levels. This, in turn, lessens the risk of heart disease. Additionally, adaptogens like ashwagandha or Withania somnifera help the body manage stress by regulating cortisol levels. Plenty of clinical trials show that ashwagandha extracts can lower cortisol, reduce anxiety symptoms, and improve overall well-being by modulating the hypothalamic pituitary-adrenal (HPA) axis. This highlights how herbal remedies are supported by scientific research, and they operate on complex biochemical mechanisms to achieve their therapeutic effects. However, these are not just theoretical. If you start consuming herbal remedies on a daily basis, it involves specific strategies to maximize their benefits while ensuring safety. Dr. Barbara O'Neill emphasizes the importance of consistency and proper dosages when using herbs. For daily use, you can integrate herbal teas, tinctures, capsules, or powders into meals and beverages. For example, adding adaptogenic herbs like ashwagandha or rhodiola to smoothies can help combat stress, while chamomile tea can promote relaxation and aid sleep. When using herbs, it's crucial to consider safety and potential interactions with medications. Many herbs can interact with pharmaceutical drugs, affecting their effectiveness or increasing side effects. For instance, St. John's wort may reduce the effectiveness of antidepressants and birth control pills by inducing liver enzymes that metabolize these medications faster. Similarly, ginkgo biloba can enhance the effects of anticoagulants like warfarin, increasing the risk of bleeding. Dr. O'Neill advises that it is always important to monitor for side effects, as some herbs can cause gastrointestinal distress, allergic reactions, or headaches. For example, excessive consumption of ginger can lead to heartburn, while high doses of echinacea may trigger allergic reactions in sensitive individuals. After all, if you want to ensure quality, you need to source herbs from reputable suppliers. Otherwise, contaminants can compromise their safety. Plus, you must know your recommended dosages properly, which is provided on packaging generally. If you consistently include herbs in your diet, you'll be significantly fitter and healthier than if you didn't consume them. In that context, Dr. Barbara O'Neill also shares some real-life success stories to illustrate the greatness of natural remedies. One notable testimonial involves a woman suffering from chronic digestive issues. After she added cayenne pepper into her diet, as per Dr. O'Neill's advice, she experienced significant improvements in her gastrointestinal health. The active compound capsaicin in cayenne pepper not only stimulates digestion by increasing gastric secretions, but also possesses anti-inflammatory properties that helped alleviate her discomfort. Within weeks, she reported a noticeable reduction in bloating and enhanced nutrient absorption, ultimately leading to increased energy levels. And that's not the only case. Once, a man sought detoxification after years of unhealthy eating habits. He turned to activated charcoal, renowned for its adsorbent properties, which help eliminate toxins from the body. He began taking activated charcoal supplements and noticed a dramatic change in his overall well-being. Charcoal's ability to bind to harmful substances in the gut facilitated the removal of unwanted toxins, leading to improved digestion and relief from occasional bloating. Ultimately, he ended up with a complete lifestyle transformation, achieving optimal health. Lastly, Dr. O'Neill recounts the experience of another woman who struggled with painful cysts. After extensive research, she opted for castor oil, known for its anti-inflammatory and analgesic properties. By applying castor oil topically to the affected areas and utilizing a warm compress, she experienced significant reductions in pain and swelling. Within weeks, the cysts diminished in size, demonstrating the oil's efficacy in supporting the body's natural healing processes. Her successful use of castor oil underscores the potential of natural remedies to facilitate recovery and enhance quality of life. So if they can start a new and healthier life with herbal remedies, why not you? And there are countless reasons you should start this. Let me walk you through it once again. Herbs have deep-rooted historical significance in healthcare, tracing their application back to ancient civilizations including Egypt, China, and Greece, where they were integral to medical practices. Key herbs like St. John's wort have been utilized for centuries to alleviate symptoms of depression, demonstrating effectiveness through various studies that support its role in enhancing mood. Similarly, turmeric, renowned for its anti-inflammatory properties, contains curcumin, a compound backed by research for its ability to reduce inflammation and support joint health. Cayenne pepper contains capsaicin, which is effective for pain relief and may improve digestive health by stimulating digestive enzymes. Activated charcoal, widely recognized for its detoxification capabilities, binds to toxins in the gastrointestinal tract, reducing their absorption and helping alleviate gas and bloating. Castor oil, often used for its laxative properties, also promotes hair growth and skin hydration, reflecting its versatile applications in holistic health. Onions are rich in quercetin, an antioxidant that supports immune function and has anti-inflammatory effects. Consuming herbs is not a daunting task either. Consuming herbal remedies in daily life helps people connect with natural healing and take control of their health. Dr. O'Neill encourages her practitioners to try these herbs and share their experiences to build a community focused on holistic health. But there's more to it. Apart from giving lectures herself, Dr. Barbara O'Neill also offers a wealth of resources for those seeking to deepen their understanding of holistic health principles. Her books, such as The Essential Guide to Herbal Safety and Healing Foods, provide comprehensive insights into natural remedies and nutrition, available for purchase on platforms like Amazon and her official website. O'Neill also shares her expertise through online courses, including the Complete Herbal course, which covers herbalism fundamentals and practical applications for health improvement. Additionally, she conducts workshops focusing on various topics such as essential oils, natural healing, and detoxification strategies. These courses are designed to empower individuals with practical skills for enhancing well-being and can often be found on her website, where users can also access her blog featuring articles on health-related topics. By using these resources, you can effectively enhance your understanding and properly apply holistic health principles in your life. So, what herbal remedies have you tried and which ones do you swear by? And speaking of remedies and tips, if you are suffering from any liver problem and looking for a cure, don't waste any more time. The liver is more important as an organ than we often realize. Just click on this video, refer to. If you're struggling with liver issues, watch this and learn what you need to do. Don't forget to share your experiences in the comments below. And like, subscribe, and hit the bell icon for more insights into natural healing.